A little known but critically important panel of public health experts, the Advisory Committee on Immunization Practices, or ACIP, meets around this time every summer to fine-tune vaccine guidelines. Now, those recommendations usually go straight to the CDC director, who typically approves them without any issue. While the committee rarely draws public attention, its work is vital to protecting Americans from vaccine-preventable diseases. In fact, countries around the world have modeled their immunization programs on ACIP's guidance until now. In just a few weeks, the committee's credibility has been upended. The Health Secretary, Robert F. Kennedy Jr., removed all 17 of the committee's highly respected members and replaced them with just 7 new appointees, many of whom public health experts have warned are unqualified or openly hostile to vaccines. Take the new committee co-chair, Martin Kulldorff. In October 2020, at the height of the COVID-19 pandemic, he co-authored a public letter urging the immediate reopening of schools and businesses, well before vaccines were available. Then there's Vicki Pebsworth, a volunteer director for the National Vaccine Information Center. Despite its name, it is widely recognized as one of the nation's leading sources of vaccine misinformation. And perhaps most infamous, Robert Malone, a man who gained notoriety during the pandemic by promoting conspiracy theories, including false claims that COVID vaccines cause a form of AIDS. These are now the people deciding how to control infectious disease outbreaks in America. The people deciding when and how our children should be vaccinated. People who've spent years casting doubt on vaccines and promoting junk science. When Trump nominated RFK as health secretary, RFK told NBC News he wasn't going to, quote, take away anyone's vaccines. But actions speak louder than words, and he has now stacked the federal vaccine committee with known vaccine skeptics. The Senator Bill Cassidy of Louisiana, a medical doctor and the top Republican on the Senate Health Committee, called on ACIP to delay its first meeting. Cassidy warned that the appointees, quote, do not have significant experience studying microbiology, epidemiology, or immunology, and that some appear to have a preconceived bias, end quote, against new technologies like mRNA vaccines. He added, quote, the meeting should be delayed until the panel is fully staffed and with more robust and balanced representation as required by law, including those with more direct relevant expertise, end quote. The meeting went ahead anyway. Last week, among the presenters was Lynn Redwood, a former president of Children's Health Defense, which is an anti-vaccine nonprofit founded by RFK himself. The presentation she was planning to give cited a study alleging thimerosal, which is a preservative used in some vaccines, causes autism. But the scientist listed as the co-author of that study said she'd never done such a study. And while that slide was removed from the presentation, Redwood continued pushing the false narrative. In the end, the panel voted against flu vaccines that contained thimerosal. One infectious disease epidemiologist who attended the meeting told the LA Times the panel spent the entire time, quote, platforming misinformation and manipulating data, end quote. All right, I'm joined now by Dr. Irwin Redlener, founding director of the National Center for Disaster Preparedness at Columbia University. He was a member of Joe Biden's COVID advisory committee during the 2020 pandemic. Redlener is also an MSNBC public health analyst. I'm also here with Laurie Garrett, a Pulitzer Prize-winning journalist who specializes in science and science research. She's the former senior fellow for global health with the Council on Foreign Relations. Welcome to both of you. Thank you for being with us. Irwin, I don't know how to sort of I'm sure our viewers all know this. The advent of vaccines and the ability to vaccinate people after things are well studied has extended life expectancy in the U.S. and around the world for decades. We are significantly moving backward with the idea of stacking a vaccine committee at the federal level with vaccine skeptics who rely on junk science.
Yeah, well, hi, Ali. So the fact of the matter is that Bobby F. Kennedy Jr., the HHS secretary, is the most unqualified, misfit Secretary of Health and Human Services ever in the United States history since HHS was invented. And actually, the actions that they are doing under his direction are undermining not only essential vaccine information for Americans, but they're pulling the legs out of the vaccine programs globally. And I'm telling you, we have a public health clown show now in this advisory committee None of them deserve to be on an advisory committee talking about vaccine legitimacy. They're a bunch of cranks, they're conspiracists, and they are promoting a very, very dangerous idea that's been debunked over and over again, that vaccines are dangerous. And Ali, as you just said, as Lori knows more than almost anybody, vaccines save lives. And these people under Bobby Kennedy are trying to undermine something that's scientific public health fact. And, you know, by the way, Bobby was a long standing anti-vaxxer. And now he's got the largest public health megaphone in the world as Secretary of HHS. And I don't know how we're going to fix this, but right now we need to find ways to neutralize what these people are saying.
Lori, during all of COVID, right, literally from the beginning, you and Erwin have been with us talking about some of these things. And there are valid reasons in the world why people are skeptical of vaccines, particularly fast-developed vaccines. And you remember I went around the country talking to people about those things. But there's a lot of misinformation out there. And here's what really worries me. As a result of these controversial new appointments, health organizations like the American Academy of Pediatrics and the CDC, both of which are usually aligned, will now be putting out conflicting information. On top of that, medical experts are now in the process of forming an alternative vaccine advisory panel, which is being dubbed the Vaccine Integrity Project. So while somebody's going to be putting out correct information, people who rely on their phones and Google are going to now hear different things about the safety of vaccines.
Well, Ali, they have been hearing different things about vaccines for quite some time. And we have a real problem globally because when we were in lockdown during COVID, we had a real disruption in supply chains and in the capacity of public health to administer vaccines to children. And so we already were seeing a big drop off in vaccination rates around the world and here in the United States. WHO just this week released a data survey that shows a 20% increase in measles diagnoses worldwide since 2022 because of the drop off in vaccination rates. People are very confused. And let me just take that example of thimerosal and mercury. For his entire career as a litigator, filing lawsuits right and left, RFK Jr. has found that sort of 1 in 1 billion incidents of a problem associated with chemical X, Y, or Z, and then filed lawsuits successfully on behalf of that one person who actually gets sick in some way. And he's made all kinds of statements that are just completely wrong. He wrote a book where he claimed there were more than 500 studies showing that mercury used in vaccines causes neurotoxic effects. But in fact, almost all the studies he cites either don't show that at all, or they are not about ethyl mercury, which is what is in thimerosal. They're about methyl mercury, a far more toxic compound that is a neurotoxin that was the cause of Minamata's disease, the famous horrible mercury poisoning episode in the 1950s in Japan. And that is found in where? Tuna fish. If you feed your children tuna sandwiches regularly, they are getting exposed to methyl mercury constantly. If you get vaccinated, it's a far less toxic, far less dangerous compound, ethyl mercury. And everything about the way this MAHA is unfolding, this Make America Healthy Again campaign, including the attacks on vaccines, is taking, twisting information just the way this ethyl mercury versus methyl mercury does, to make huge sweeping allegations about programs that have been conducted in public health successfully for generations, that have saved hundreds of millions of lives all over the world, raised life expectancy all over the planet, And especially we are benefiting from that increase here in the United States and twisting them into narratives that are completely false and are terrifying people. And so out there, yes, people are confused. People don't know what truth is. And now they have a government that is, first of all, at the level of the president, committed to disinformation and to twisting the truth to conform to, yes, I did eliminate all nuclear weapons in Iran. But also going even further down, it's committed to destroying the truth-generating enterprise of science, so that this whole layer of attacking vaccines is just one piece on top of a far larger agenda.
And this is important to note, because you're absolutely right to point out that, Lori, even before COVID, medical misinformation and disinformation was the most prevalent sort of misinformation there was on the internet. And now we're making it worse. Erwin, the Senate held confirmation hearings for Donald Trump's pick for CDC director, Susan Monares, this past week. Now, I guess I'm asking you, if she's confirmed, she would be the one to approve the panel's guidelines on vaccine use. And I don't know whether she would be inclined to do so. But how might that work? Could this person whose picture we were just looking at be the backstop here or not?
Oh, yes, she might be. And listen, Susan may be the bright light in all of this, Ollie. I mean, her history and her record at CDC, how she approaches scientific evidence to drive public policy, so far in her history has been fine. We'll see if she can have the strength to stand up and do what she normally does and confront the Vaccine Advisory Committee, confront her boss, Bobby Kennedy, and confront Donald Trump and speak the truth. If she does, this may be the saving grace in this otherwise nightmare of a degraded public health system in the United States. I'd like to be looking at the glass half full when it comes to this CDC appointee. We'll see what happens. And I don't know what she's promised the White House in terms of what she would actually do, but can we at least hope for the best for a little while? Like, I need to.
That's all we have right now.